Sarah Martinez had always been different from the other recruits in her basic training unit. While most of them came from military families or had dreamed of joining the army since childhood, Sarah's path to the military was born out of necessity rather than patriotic fervor. Growing up in a small town in rural Texas, she had watched her single mother work 3 jobs just to keep food on the table and a roof over their heads. When her younger brother was diagnosed with a rare medical condition that required expensive treatments, Sarah knew she had to find a way to help her family financially while also getting the medical training she desperately wanted. The military seemed like the perfect solution. She could serve her country, get the education she needed to become a paramedic, and send money home to help with her brother's medical bills. What she hadn't anticipated was how difficult it would be to prove herself in a world that seemed determined to remind her that she didn't belong. The Advanced Combat Medical Training Program at Fort Sam Houston was known for being one of the most rigorous medical training programs in the military. Out of the 60 recruits who started the program, only about half would make it through to graduation. The instructors were tough, the coursework was demanding, and the practical exercises were designed to push every student to their absolute limits. Sarah's class was a diverse mix of men and women from all walks of life, but she quickly noticed that most of her fellow students had backgrounds that seemed much more impressive than hers. There was Marcus, whose father was a retired Army colonel and whose grandfather had served in Vietnam. Jennifer came from a family of doctors and had already completed 2 years of pre-med before deciding to join the military. David had been a paramedic in Chicago before enlisting, bringing years of real-world emergency medical experience to the classroom. Then, there was Sarah, who had worked at her town's only diner since she was 16 and whose medical experience consisted of basic first aid training she had received as a volunteer at the local fire department. She felt like an imposter from day one, constantly worried that someone would figure out that she didn't belong in such an elite program. The first few weeks of training were a blur of anatomy lessons, pharmaceutical studies, and endless drills. Sarah threw herself into her studies with a determination that bordered on obsession. While her classmates went out for drinks or relaxed in their barracks during their free time, Sarah could be found in the library or the study hall, poring over medical textbooks and practicing procedures until her hands could perform them without conscious thought. Despite her dedication, Sarah struggled with some of the more theoretical aspects of the training. The advanced pharmacology classes were particularly challenging for someone who had never taken college-level chemistry. While students like Jennifer breezed through discussions of drug interactions and metabolic pathways, Sarah had to work twice as hard just to keep up with the basic concepts. Her practical skills, however, were a different story. Sarah had always been good with her hands, a skill she had developed during her years helping her mother with various odd jobs around their neighborhood. She could fix a leaky faucet, repair a broken fence, or jury-rig almost anything with whatever materials were available. This practical problem-solving ability served her well in the hands-on portions of their medical training. The instructors at the Combat Medical Training Program were a mix of active-duty military personnel and civilian contractors, all with extensive experience in combat medicine or emergency care. The lead instructor was Sergeant First Class Rodriguez, a gruff man in his 40s who had served multiple tours in Afghanistan and Iraq as a combat medic. He had seen more traumatic injuries than most emergency room doctors and had a reputation for being incredibly demanding but fair in his expectations. Rodriguez believed that combat medics needed to be prepared for anything, and his training reflected that philosophy. Students were expected to master not just the standard medical procedures, but also to think creatively when faced with limited resources or unusual circumstances. He often created scenarios where students had to improvise medical solutions using whatever materials were available, emphasizing that in combat situations, they might not always have access to proper medical supplies. Sarah's first real challenge came during a practical exercise in the 4th week of training. The class was divided into teams and given a series of simulated casualties to treat. Each team was provided with a standard field medical kit and had to work together to stabilize and treat multiple patients with various injuries ranging from gunshot wounds to severe burns. Sarah's team consisted of herself, Marcus, Jennifer, and a quiet student named Kevin who had previously worked as an EMT in rural Montana. The scenario they were given involved a simulated IED explosion that had resulted in multiple casualties with various traumatic injuries. They had 20 minutes to assess, treat, and prioritize evacuation for 4 different patients. The team immediately ran into problems with leadership and communication. Marcus, confident in his military background, tried to take charge but lacked the medical knowledge to make informed decisions quickly. Jennifer had the medical knowledge but seemed overwhelmed by the chaos and time pressure of the scenario. Kevin knew what needed to be done but was too quiet to assert himself in the group dynamic. Sarah found herself in the familiar position of being overlooked and underestimated. When she tried to suggest treatment priorities based on what she had learned about triage, Marcus dismissed her ideas, insisting that they follow the textbook procedures exactly as they had been taught. Jennifer agreed with Marcus, pointing out that Sarah didn't have the educational background to understand the more complex medical decisions they needed to make. Frustrated but determined to help her team succeed, Sarah focused on what she could control. While the others debated treatment protocols, she began organizing their medical supplies and setting up treatment areas for each of the simulated casualties. She noticed that one of the mannequins representing a patient with a severe leg wound was losing simulated blood at a rate that would require immediate intervention to prevent death from blood loss. The standard protocol called for applying pressure to the wound and then using a combat tourniquet from their medical kit to stop the bleeding. However, when Sarah went to grab the tourniquet, she discovered that it was missing from their kit. She quickly informed her teammates, but they were too focused on their debate about treatment priorities to pay attention to what she was saying. With time running out and the simulated patient continuing to lose blood, Sarah knew she had to act. She looked around at the materials available to her and remembered a technique her grandfather had taught her years ago. Her grandfather had been a rancher and had shown her how to use a makeshift tourniquet to stop bleeding in injured cattle when the veterinarian wasn't available. Sarah grabbed a bandage from their kit and a pen from her pocket. She wrapped the bandage around the mannequin's leg above the wound and tied it loosely. Then, she inserted the pen through the knot and began twisting it, using the pen as a windlass to tighten the bandage until it compressed the simulated artery enough to stop the bleeding. Her teammates finally noticed what she was doing when she called out that she had successfully controlled the bleeding on patient number 3. Marcus looked over and immediately began criticizing her improvised solution. "That's not how you're supposed to do it," he said loudly enough for other teams and instructors to hear. "We're supposed to use proper equipment, not make things up as we go along. This isn't some backwoods first aid class." Jennifer nodded in agreement, adding, "Sarah, I know you're trying to help, but we need to follow established medical protocols. What you've done there looks like something you'd see in an old war movie, not modern combat medicine." Several students from other teams had stopped their own work to watch the commotion. Some began laughing and making jokes about Sarah's improvised tourniquet. Comments like MacGyver medicine and hillbilly first aid could be heard from around the training area. Sarah felt her face burning with embarrassment, but she knew that her improvised tourniquet was effectively controlling the bleeding, which was the primary goal of the exercise. Kevin, who had been quietly observing the situation, finally spoke up in Sarah's defense. "Actually, what she did is working. Look at the blood loss indicator on the mannequin, it stopped completely. But the damage was done." The other students continued to mock Sarah's unconventional approach, and even some of the instructors seemed to be shaking their heads disapprovingly. Sarah felt smaller and more out of place than ever before. The exercise continued for another 15 minutes, but Sarah's confidence was shattered. She completed the remaining tasks mechanically, following the lead of her teammates without offering any more suggestions or taking any more initiative. When the time was called, their team had successfully stabilized all 4 patients, but Sarah felt like a failure. During the debriefing session that followed, each team was asked to present their approach to treating the various casualties and explain their decision-making process. When it came time to discuss patient number 3, the one with the severe leg wound, Marcus made a point of apologizing for his team's deviation from proper protocol. "We had a minor equipment failure," he explained to the class and instructors. We were missing our combat tourniquet, and one of our team members improvised a solution that, while creative, wasn't really appropriate for the level of training we're supposed to be demonstrating here. The comment drew more laughter from the other students, and Sarah felt herself sinking lower in her chair. She wished she could disappear entirely. All of her hard work and dedication seemed meaningless in the face of her peers' ridicule and her own perceived failure to meet the program's standards. After the debriefing, the students were dismissed for lunch. As Sarah packed up her equipment, she overheard several conversations that made it clear the story of her hillbilly tourniquet was already spreading throughout the training company. She could imagine how the story would grow and change as it was retold, probably becoming more ridiculous with each telling. Sarah decided to skip lunch and instead went to the base library, where she could be alone with her thoughts and try to process what had happened. She found a quiet corner and sat down with a medical textbook, but the words on the page blurred as tears of frustration and embarrassment filled her eyes. For the first time since arriving at Fort Sam Houston, Sarah seriously considered whether she had made a mistake in pursuing this path. Maybe Marcus and Jennifer were right. Maybe she didn't belong in an advanced medical training program. Maybe she should have stayed home and found some other way to help her family financially. The afternoon classes seemed to drag on forever. Sarah tried to pay attention to the lecture on combat pharmaceuticals, but she couldn't stop thinking about the morning's exercise and her classmates' reactions. She noticed that several students kept glancing in her direction and whispering to each other, confirming her suspicion that she had become the subject of gossip throughout the training company. When the day's classes finally ended, Sarah made her way back to her barracks room, hoping to spend the evening studying in solitude. She had a test on trauma assessment procedures coming up the next day, and she knew she needed to score well to maintain her position in the program. As she entered her room, she found her roommate, a cheerful young woman named Lisa from California, waiting for her with a concerned expression on her face. "Hey, Sarah," Lisa said gently. "I heard about what happened in your practical exercise today. Are you okay?" Sarah tried to put on a brave face, but Lisa's kindness broke through her defenses, and she found herself telling the whole story. She explained how she had tried to contribute to her team's success, how she had improvised a solution when their equipment failed, and how she had been humiliated in front of the entire class. Lisa listened carefully and then shook her head in disgust. "Those guys are idiots," she said firmly. "I've been in emergency medicine for 3 years before I enlisted, and I can tell you that improvising with available materials is a crucial skill for any medic, whether you're in combat or working in a civilian emergency room. But they're right that I don't have the background that everyone else has," Sarah replied. "Maybe I'm just not cut out for this." "That's nonsense," Lisa said. "You're one of the hardest working students in our entire company. I see you studying when everyone else is sleeping. I see how carefully you practice every procedure until you get it right. Background doesn't matter nearly as much as dedication and the ability to think under pressure, and you've demonstrated both of those things." Lisa's words helped Sarah feel slightly better, but the embarrassment and self-doubt from the day's events continued to weigh on her mind as she tried to study for the next day's test. The test on trauma assessment procedures was comprehensive, covering everything from initial patient evaluation to advanced diagnostic techniques. Sarah had studied extensively and felt reasonably prepared, but she was still nervous about her performance given the events of the previous day. The written portion of the test went well. Sarah was able to answer most of the questions confidently, drawing on the countless hours she had spent memorizing procedures and protocols. The practical portion of the test, however, would be more challenging. Students were required to demonstrate proper trauma assessment techniques on standardized patients, actors who were trained to simulate various types of injuries and medical conditions. Sarah's assigned scenario involved a patient with multiple traumatic injuries from a vehicle accident, including possible internal bleeding, a suspected spinal injury, and obvious fractures to both legs. As Sarah began her assessment, she tried to block out the memories of the previous day's humiliation and focused entirely on the patient in front of her. She followed the standard trauma assessment protocol methodically, checking airway, breathing, and circulation before moving on to a more detailed examination of specific injuries. The standardized patient was doing an excellent job of portraying someone in severe pain and distress, moaning and, occasionally crying out during Sarah's examination. This added an element of realism that made the assessment more challenging but also more meaningful. Sarah's hands moved confidently as she palpated the patient's abdomen, checking for signs of internal bleeding, and carefully examined the suspected spinal injury without causing further damage. She was pleased to find that all of her studying and practice had paid off. The procedures felt natural and automatic, allowing her to focus on gathering information rather than remembering what to do next. When she reached the examination of the patient's leg injuries, Sarah was confronted with a scenario that hit close to home. The patient had what appeared to be a severe compound fracture of the right leg with significant bleeding. In a real emergency situation, this would require immediate intervention to prevent the patient from going into shock from blood loss. For a moment, Sarah hesitated, remembering the ridicule she had faced the day before for her improvised tourniquet. But then, she looked at the simulated blood pooling beneath the standardized patient's leg and remembered why she was there in the first place. She wasn't there to impress her classmates or avoid embarrassment. She was there to learn how to save lives. Sarah quickly applied pressure to the wound with sterile gauze and then reached for a combat tourniquet from the medical kit provided for the test. This time, the equipment was all present and accounted for, and she was able to apply the tourniquet using the standard military protocol she had practiced dozens of times. As she worked, Sarah felt a sense of confidence returning. This was what she was meant to do. This was why she had sacrificed so much to be here. The opinions of her classmates mattered far less than her ability to provide competent medical care when someone's life depended on it. The rest of the practical examination went smoothly, and Sarah finished within the allotted time frame. As she documented her findings and treatment decisions, she felt satisfied with her performance. Whatever happened with her test scores, she knew that she had demonstrated competency in the skills that really mattered. The results of the test were posted 2 days later. Sarah had scored in the top 10% of the class on both the written and practical portions. When she saw her scores, she felt a surge of pride and relief. Maybe she did belong here after all. However, her moment of triumph was short-lived. As she stood looking at the test results posted on the bulletin board, she overheard a group of her classmates discussing the scores. "I can't believe Martinez scored so high," one of them said. "She must have gotten lucky with an easy practical scenario." "Yeah," another replied. "Anyone can memorize textbook answers for a written test. Wait until we get to the really advanced stuff. That's when people with real medical backgrounds will separate themselves from the wannabes." Sarah felt the familiar sting of their dismissive comments, but this time she also felt something else: determination. She was tired of being underestimated and written off by people who didn't know anything about her capabilities or her dedication. She decided that rather than letting their comments discourage her, she would use them as motivation to prove them wrong. The weeks following the trauma assessment test brought increasingly complex challenges as the combat medical training program moved into advanced procedures and emergency medicine protocols. Sarah threw herself into her studies with renewed determination, spending every spare moment in the medical simulation lab or studying advanced treatment protocols. She had made a personal promise to herself that she would not only complete the program but excel in it, regardless of what her classmates thought about her background or capabilities. The program's curriculum had shifted to focus on combat-specific medical scenarios that medics might encounter in active deployment zones. Students learned advanced airway management techniques, surgical procedures that could be performed in field conditions, and complex medication protocols for treating combat injuries. The stakes felt higher with each passing day, as instructors constantly reminded the class that the skills they were learning would literally mean the difference between life and death for wounded soldiers. Sarah's study group had naturally formed around students who shared her serious approach to the material. Kevin, the quiet former EMT from Montana, had become her closest study partner. Despite his reserved nature in group settings, Kevin was incredibly knowledgeable and had a talent for explaining complex medical concepts in simple terms. Lisa, her roommate, also joined their study sessions, bringing her experience from civilian emergency medicine to help bridge the gap between textbook knowledge and practical application. The trio spent countless evening hours in the barracks common room, using medical mannequins to practice procedures and testing each other on drug dosages and treatment protocols. Their dedication hadn't gone unnoticed by other students, but reactions were mixed. Some classmates respected their work ethic, while others seemed to view their intensive studying as showing off or trying to make everyone else look bad. Marcus and Jennifer had formed their own study group with several other students who shared similar educational backgrounds. This group often made pointed comments about some people who needed to study twice as hard because they didn't have proper preparation for the program. While these comments were never directed specifically at Sarah, it was clear to everyone who they were talking about. The tension between different factions in the class came to a head during a particularly challenging practical exercise in week 8 of the program. The exercise was designed to simulate a mass casualty event in a forward operating base that had come under attack. Students were divided into medical teams and given 15 minutes to treat 8 different casualties with varying degrees of injury severity. The scenario was deliberately chaotic, with instructors playing the roles of wounded soldiers who were screaming, bleeding, and demanding immediate attention. Smoke machines created limited visibility, and loud recordings of explosions and gunfire added to the sensory overload. The exercise was designed to test not just medical skills but also the ability to function effectively under extreme stress and confusion. Sarah found herself assigned to the same team as Marcus and Jennifer, along with 2 other students she didn't know well. As soon as the exercise began, the familiar pattern of dismissiveness towards Sarah's contributions emerged. When she attempted to suggest a triage approach based on the principles they had learned for prioritizing casualties, Marcus cut her off with a sharp gesture. "We don't have time for amateur input right now," he said curtly. "Jennifer and I will handle the medical decisions. You can help with basic tasks like moving supplies." Sarah felt the familiar surge of frustration but decided to focus on what she could control rather than fighting for recognition. She began organizing medical supplies and establishing treatment areas while Marcus and Jennifer debated which casualties to address first. As she worked, she noticed that their debate was consuming precious time while patients continued to bleed and deteriorate. The simulated casualties were arranged throughout the training area in positions that reflected the random nature of combat injuries. Some were clustered together near what represented a damaged vehicle, while others were scattered across the space. Sarah quickly assessed that their team would need to establish a systematic approach to patient evaluation and evacuation if they hoped to save the maximum number of lives within the time limit. While Marcus and Jennifer continued their discussion, Sarah began implementing her own triage system. She moved quickly between casualties, spending no more than 30 seconds on each initial assessment to determine injury severity and treatment priorities. Her approach was based on the principle of doing the greatest good for the greatest number of patients, which sometimes meant making difficult decisions about who could be saved and who was beyond help. The first casualty Sarah assessed appeared to be a soldier with severe burns covering more than 60% of his body. In a real combat situation, this patient would likely require resources that could be better used to save multiple other lives. The simulation instructor playing this role was doing an excellent job of portraying someone in extreme agony, begging for help and pain medication. Sarah felt her heart breaking as she made the difficult decision to mark this casualty as expectant care, meaning that treatment resources would be focused on patients with better chances of survival. This was one of the hardest lessons in combat medicine. Sometimes the most compassionate thing a medic could do was acknowledge that certain injuries were beyond their ability to treat in a resource-limited environment. Moving to the next casualty, Sarah found a simulated soldier with what appeared to be a penetrating abdominal wound and signs of internal bleeding. This patient was conscious and responsive, which suggested that vital organs might not be severely damaged. With proper treatment, this patient had a good chance of survival and would be classified as immediate priority for evacuation and surgery. Sarah quickly applied pressure to the wound and established an 4-line to begin fluid replacement. As she worked, she called out to her teammates about her findings and recommended treatment priorities, but they were still engaged in their own debate and didn't seem to be listening to her input. The third casualty presented a different challenge entirely. The simulated patient appeared to have a severe traumatic brain injury with decreased consciousness and irregular breathing patterns. In civilian medicine, this patient would receive immediate intensive care, but in a combat environment with limited resources, the prognosis for severe head injuries was often poor. Sarah spent an extra few seconds evaluating this patient, looking for any signs that might indicate a better prognosis than initially appeared. She checked pupil response, assessed breathing patterns, and looked for other injuries that might be affecting the patient's consciousness. Her careful evaluation revealed that what initially appeared to be a brain injury might actually be severe blood loss from a partially concealed leg wound that was causing shock and decreased mental status. Working quickly, Sarah exposed the patient's legs and found a severe arterial bleed from the upper thigh that had been partially hidden by the patient's position. This was exactly the type of injury that could be rapidly fatal if not treated immediately, but which could be completely survivable with proper intervention. Sarah reached for a combat tourniquet from her medical kit, but her hand stopped as she remembered the ridicule she had faced during her previous improvised tourniquet application. For a moment, she hesitated, wondering if she should call Marcus or Jennifer over to apply the tourniquet so that there wouldn't be any question about proper protocol. But then, she looked at the simulated blood pooling beneath the patient, and remembered that in a real combat situation, every second would matter. A wounded soldier wouldn't care about proper protocol, or who applied the tourniquet. They would only care about surviving. Sarah quickly applied the combat tourniquet according to the standard military procedure she had practiced countless times. As soon as the tourniquet was tightened properly, the simulated bleeding stopped, and the patient's vital signs began to stabilize. Sarah marked this casualty as immediate priority and moved on to continue her systematic assessment of the remaining patients. By the time Marcus and Jennifer had finished their planning discussion and were ready to begin treating patients, Sarah had already completed initial assessments of all 8 casualties and had begun treatment on the 3 most critical cases. Her systematic approach had identified which patients needed immediate intervention, which could wait for delayed treatment, and which were beyond help. Marcus was clearly irritated when he realized that Sarah had been working independently rather than waiting for direction from the team leaders. "What do you think you're doing?" he demanded. "We're supposed to be working as a team, not having individuals run around making medical decisions without consultation. She's been triaging patients while you guys have been talking." Kevin spoke up from across the training area where his team was working. "Look at her patient status boards. She's got everyone properly categorized and has already started treatment on the critical cases." Jennifer looked over at Sarah's work and had to admit that the triage decisions appeared to be sound. The patients Sarah had marked as immediate priority were clearly the ones who needed the most urgent attention, and her treatment interventions had already stabilized 2 patients who might otherwise have died during the exercise. "Fine," Jennifer said grudgingly. "But we still need to coordinate our efforts instead of having everyone work separately. Sarah, walk us through what you've found so we can establish proper treatment priorities." Sarah quickly briefed her teammates on each casualty, explaining her assessment findings and the rationale behind her triage decisions. Despite their initial resistance to her taking initiative, Marcus and Jennifer had to acknowledge that her systematic approach had given their team a significant advantage in managing the complex scenario. The remaining time in the exercise was spent implementing treatment plans for each patient according to the priorities Sarah had established. Working together, the team was able to provide appropriate care for all 8 casualties within the time limit, with all survivable patients receiving the interventions they needed. During the post-exercise debriefing, the instructors praised Sarah's team for their efficient triage system and systematic approach to managing multiple casualties. Sergeant First Class Rodriguez specifically noted that their team had demonstrated textbook triage principles under pressure, correctly identifying treatment priorities and allocating resources appropriately. "The key to success in mass casualty situations," Rodriguez explained to the class, is rapid assessment and decision-making. You don't have time for lengthy discussions about treatment plans when people are bleeding to death. The medic who can quickly and accurately assess casualty priority and begin appropriate treatment will save more lives than someone who knows every medical textbook but can't make decisions under pressure. Several students from other teams asked Sarah about her triage methodology and how she had managed to assess all 8 patients so quickly. She explained her systematic approach and the decision-making criteria she had used, drawing on both her classroom learning and the practical problem-solving skills she had developed throughout her life. For the first time since arriving at Fort Sam Houston, Sarah felt like her classmates were looking at her with respect rather than dismissal. Even Marcus and Jennifer seemed to acknowledge that her contributions had been valuable, though they were clearly uncomfortable admitting that someone they had written off had outperformed them in such a visible way. The success in the mass casualty exercise gave Sarah a boost of confidence that carried over into her other coursework. She began speaking up more in classroom discussions, offering insights based on her growing understanding of combat medicine principles. Her questions were thoughtful and demonstrated that she was thinking critically about the material rather than just memorizing procedures. Instructors began to notice Sarah's engagement and the quality of her contributions to class discussions. During a particularly complex case study about treating multiple trauma patients with limited resources, Sarah offered a creative solution that impressed even the most experienced instructors. The case study involved a scenario where a medic was treating 3 critically wounded soldiers but only had enough blood products to save 2 of them. Students were asked to discuss how they would make such an impossible decision and what factors they would consider in allocating limited medical resources. Most students focused on standard triage criteria like injury severity and probability of survival. Sarah, however, approached the problem from a different angle entirely. She suggested that the medic should look for creative ways to extend the available blood products or find alternative treatments that might allow all 3 patients to survive, even if their recovery would be more challenging. Sometimes the best medical decision isn't about choosing who lives and who dies, Sarah explained to the class. Sometimes it's about finding a way to give everyone a fighting chance, even if that means using unconventional approaches or taking calculated risks. Her perspective sparked a lengthy discussion about innovation in combat medicine and the importance of thinking beyond standard protocols when faced with impossible choices. Several instructors contributed their own experiences from combat deployments where creative problem-solving had made the difference between life and death. Sergeant First Class Rodriguez was particularly intrigued by Sarah's approach to the ethical dilemma. After class, he asked her to stay behind for a few minutes to discuss her thoughts in more detail. Martinez, he said, I've been teaching this program for 6 years, and I've seen hundreds of students work through that case study. Most of them get so focused on following proper protocol that they forget to think creatively about the problem. Your willingness to challenge conventional approaches and look for innovative solutions is exactly what we need in combat medics. Rodriguez went on to explain that some of the most effective medics he had served with in combat were those who could adapt and improvise when standard procedures weren't sufficient. In a textbook scenario, you have all the right equipment, perfect conditions, and plenty of time to follow established protocols, he said. In real combat situations, you're lucky if you have half of what you need and twice as many patients as you can properly handle. The medics who save the most lives are the ones who can figure out how to do more with less. Sarah felt a surge of pride at Rodriguez's words, but she also felt the weight of responsibility that came with his expectations. She knew that earning the respect of her instructors was only part of the challenge. She still needed to prove herself to her classmates, and, more importantly, to herself. The conversation with Rodriguez motivated Sarah to push herself even harder in her studies. She began seeking out additional learning opportunities, volunteering for extra lab time and asking instructors for recommendations on supplementary reading materials. She wanted to make sure that when she graduated from the program, she would be fully prepared for whatever challenges awaited her in actual deployment. Sarah's roommate Lisa had been watching her transformation with admiration and concern. While she was proud of Sarah's growing confidence and success in the program, She worried that Sarah was pushing herself too hard and not taking time to rest and recharge. "You know you don't have to prove yourself to those idiots," Lisa said one evening as Sarah prepared for another late-night study session. "You're already performing at the top of the class. You've earned your place here." "I appreciate that," Sarah replied. "But I'm not just trying to prove myself to them anymore. I'm trying to prove to myself that I can be the kind of medic that Rodriguez described, someone who can adapt and find solutions when everything goes wrong." Lisa understood Sarah's motivation, but she also recognized the signs of someone who was approaching burnout. She made a mental note to keep an eye on her roommate, and to intervene if Sarah's pursuit of excellence began to compromise her health or well-being. The next major challenge in the program came in the form of a comprehensive practical examination that would test everything students had learned up to that point. The exam consisted of 10 different stations, each presenting a different medical scenario that required both technical skills and critical thinking to resolve successfully. Students would rotate through each station individually, spending 15 minutes at each one to assess, treat, and document their findings for a standardized patient or medical simulation. The scenarios ranged from straightforward trauma cases to complex medical emergencies that required advanced diagnostic skills and treatment planning. Sarah approached the comprehensive exam with confidence tempered by healthy respect for its difficulty. She had prepared extensively, but she knew that the exam would test not just her knowledge but her ability to perform under pressure and think quickly when faced with unexpected challenges. The first few stations went smoothly for Sarah. She successfully treated simulated cases of chest trauma, severe burns, and diabetic emergency, demonstrating both technical competence and good clinical judgment. Her documentation was thorough and accurate, and she completed each station within the allotted time frame. The 7th station, however, presented a scenario that would test everything Sarah had learned about thinking creatively under pressure. The standardized patient presented with symptoms that didn't fit neatly into any of the standard diagnostic categories they had studied. The patient was conscious but confused, with vital signs that were abnormal but not immediately life-threatening. Sarah began her standard assessment protocol, checking airway, breathing, and circulation before moving on to a more detailed examination. The patient's breathing was slightly labored but not severely compromised. Heart rate was elevated but regular. Blood pressure was lower than normal but not critically low. What puzzled Sarah was the combination of symptoms that didn't seem to fit together logically. The patient complained of severe abdominal pain but also had neurological symptoms like confusion and difficulty with coordination. There were no obvious injuries or signs of trauma that would explain the presentation. As Sarah worked through her differential diagnosis, she began to consider less common causes that might explain the unusual combination of symptoms. She remembered a case study from one of her supplementary reading assignments about a soldier who had been exposed to an environmental toxin that caused similar symptoms. Following her instinct, Sarah began asking the standardized patient-specific questions about recent activities and potential exposures. Through careful questioning, she discovered that the patient had been working in an area where chemical weapons had been used several days earlier, and might have had delayed exposure to toxic agents. This revelation completely changed Sarah's approach to treatment. Rather than focusing on the individual symptoms, she began implementing protocols for chemical exposure and poisoning. Her quick thinking and willingness to consider unconventional diagnoses had led her to the correct treatment approach for a scenario that had stumped many previous students. The final 3 stations of the exam tested Sarah's ability to work with limited resources and make difficult triage decisions. In each case, she was presented with multiple patients but only enough medical supplies to properly treat some of them. These scenarios required her to demonstrate not just medical skills but also the ethical reasoning and decision-making abilities that would be crucial in combat situations. Sarah approached these challenging scenarios with the same systematic thinking that had served her well throughout the program. She quickly assessed all patients, prioritized treatment based on injury severity and probability of survival, and allocated resources to maximize the number of lives that could be saved. When the exam was completed, Sarah felt exhausted but satisfied with her performance. She had encountered several scenarios that challenged her knowledge and skills, but she had worked through each one methodically and felt confident that she had made appropriate decisions throughout the process. The results of the comprehensive practical examination wouldn't be available for several days, leaving Sarah and her classmates in a state of nervous anticipation. The waiting period coincided with the beginning of the program's most challenging phase, advanced combat medicine simulations that would test everything they had learned in realistic battlefield conditions. These final exercises were conducted at a specialized training facility that had been designed to replicate the conditions medics would face in active combat zones. The facility included mock buildings damaged by explosions, simulated vehicle crashes, and environmental hazards like smoke, debris, and challenging terrain. Students would be required to provide medical care while dealing with all the complications and obstacles they might encounter in actual deployment. Sarah had mixed feelings about entering this final phase of training. On one hand, she was excited to put her skills to the test in realistic scenarios that would demonstrate her readiness for deployment. On the other hand, she was acutely aware that these exercises would be her final opportunity to prove herself to both instructors and classmates before graduation. The first advanced simulation took place in a mock forward operating base that had supposedly come under mortar attack. Students were divided into medical teams and given 30 minutes to establish casualty collection points, treat wounded personnel, and coordinate evacuation procedures. The scenario included not just medical challenges but also tactical considerations like working under potential enemy fire and dealing with damaged equipment and infrastructure. Sarah found herself assigned to a team with students she hadn't worked with extensively before. This presented both an opportunity and a challenge. She would need to establish her credibility with new teammates while also adapting to different working styles and communication patterns. The team leader was a student named Rodriguez, no relation to their instructor, who had previous military experience as an infantry soldier before entering medical training. He had a natural command presence and good tactical awareness, but his medical knowledge was still developing. The other team members included Amanda, a former nursing student with strong clinical skills but limited experience with combat scenarios, and James, who had worked as a wilderness rescue specialist before joining the military. As the simulation began, the team was immediately confronted with the chaos and confusion of a combat medical scenario. Loud explosions and simulated gunfire created a disorienting environment, while smoke machines reduced visibility and made communication more difficult. Multiple casualties were scattered throughout the area, some crying out for help while others lay motionless and silent. Rodriguez quickly established a command structure and began directing team members to different areas of the simulation zone. His tactical experience served the team well as he identified safe areas for treating patients and established security protocols to protect the medical team while they worked. Sarah was assigned to work with Amanda in establishing a casualty collection point where patients could be brought for initial treatment and stabilization before evacuation. As they set up their treatment area, Sarah noticed that Amanda seemed overwhelmed by the noise and confusion of the combat environment. "I know this is intense," Sarah said to Amanda as they organized their medical supplies, "but try to focus on the medical tasks. The noise and chaos are just background. What matters is taking care of the patients." Amanda nodded gratefully and seemed to regain some of her composure. "I'm used to quiet hospital environments," she admitted. "This is like nothing I've ever experienced before." Sarah understood Amanda's discomfort, but she also recognized that this was exactly the kind of environment they would face in actual deployment. She began sharing some techniques she had learned for staying focused under pressure and managing stress during high-stakes situations. The first casualties began arriving at their treatment point within minutes of the simulation's start. The patients presented a wide range of injuries, from relatively minor cuts and bruises to life-threatening trauma that required immediate intervention. Sarah and Amanda worked together efficiently, with Sarah taking the lead on triage decisions while Amanda provided clinical support and documentation. One of the first patients brought to their station was a simulated soldier with multiple shrapnel wounds from a mortar explosion. The patient was conscious but in significant pain, with bleeding from several locations and possible internal injuries. Sarah quickly assessed the patient's condition and determined that immediate surgical intervention would be required. As Sarah worked to control bleeding and stabilize the patient for evacuation, she noticed that some of her medical supplies were not functioning properly. The 4 fluids she needed for volume replacement had been damaged in the simulated attack, and several of her instruments were covered in debris that made them difficult to use. Rather than panic or call for replacement supplies, Sarah began improvising with the materials available to her. She remembered techniques for creating makeshift solutions and methods for cleaning and sterilizing equipment in field conditions. Her ability to adapt and problem-solve under pressure allowed her to provide appropriate care despite the equipment limitations. Amanda watched Sarah's improvisation with fascination and growing respect. "Where did you learn to do that?" she asked as Sarah successfully established vascular access using a technique that wasn't covered in their standard training. "My grandfather taught me that you can fix almost anything if you understand the basic principles and aren't afraid to try unconventional approaches," Sarah replied as she continued working. "In medicine, the goal is always to help the patient, even if that means doing things differently than the textbook describes." The patient responded well to Sarah's interventions, and his vital signs stabilized enough for safe evacuation to the simulated surgical facility. As they prepared the patient for transport, Amanda commented on how impressed she was with Sarah's clinical judgment and technical skills. "I have to admit," Amanda said quietly, "I heard some of the stories about your improvised tourniquet early in the program, and I thought maybe you didn't understand proper medical protocols. But watching you work today, I can see that you understand the principles behind the protocols better than most people. You're not just following rules, you're actually thinking about what the patient needs." Sarah appreciated Amanda's honesty and her willingness to revise her initial impressions. "I think one of the most important things I've learned in this program is that protocols and procedures are tools to help us provide good care, but they're not ends in themselves. Sometimes the best thing you can do for a patient is to think beyond the standard approach." The simulation continued for another 20 minutes, with Sarah and Amanda successfully treating a total of 8 casualties with various types of injuries. Their casualty collection point became a model of efficiency and organization, with clear triage categories and systematic treatment protocols that maximize their ability to help multiple patients simultaneously. Near the end of the exercise, Sarah was confronted with a scenario that would test every aspect of her training and experience. A casualty was brought to their station with injuries so severe that survival seemed unlikely even with immediate surgical intervention. The patient had massive trauma to the chest and abdomen, was losing consciousness, and had vital signs that indicated imminent cardiovascular collapse. In a real combat situation, this patient would represent exactly the kind of impossible decision that medics sometimes face, whether to invest significant resources in treating someone who probably cannot be saved, or to focus those resources on patients with better chances of survival. Sarah looked at the patient and then at the other casualties waiting for treatment. She had enough medical supplies to either attempt heroic measures for this critically injured patient, or to provide appropriate care for 3 other patients with less severe but still serious injuries. The decision was made more difficult by the fact that the critically injured patient was conscious enough to be aware of what was happening. He was looking directly at Sarah with an expression that clearly communicated his desperation and his hope that she would not give up on him. Sarah knelt beside the patient and took his hand. "I'm going to do everything I can for you," she said quietly. "But I need you to understand that your injuries are very serious, and I'm going to have to make some difficult decisions about how to use the medical resources we have available." The patient squeezed her hand weakly and managed to whisper, "Do whatever you think is right. Take care of the guys who can make it." His words broke Sarah's heart, but they also confirmed that she was facing the kind of impossible ethical dilemma that combat medics sometimes encounter. She made the difficult decision to provide comfort care and pain management for the critically injured patient, while focusing her life-saving efforts on the other casualties who had realistic chances of survival. It was one of the hardest decisions Sarah had ever made, but she knew it was the right one based on the principles of combat triage and resource allocation they had studied throughout the program. In a situation with unlimited medical resources, she would have attempted every possible intervention to save the critically injured patient. But in the resource-constrained environment of combat medicine, her responsibility was to save the maximum number of lives possible. The simulation ended with Sarah's team successfully treating and evacuating 12 casualties, with only one patient classified as non-survivable due to the severity of his injuries. Their performance was among the best in the class, and instructors praised their organization, teamwork, and clinical decision-making under pressure. During the post-exercise debriefing, the instructors spent considerable time discussing the ethical challenges that students had faced during the simulation. The scenario of the critically injured patient was designed specifically to test students' understanding of triage principles and their ability to make difficult decisions under emotional pressure. Sergeant First Class Rodriguez led the discussion about the ethical dilemma Sarah had faced. In civilian emergency medicine, he explained, resources are generally abundant enough that you can attempt heroic measures for every patient. In combat medicine, you sometimes have to make choices that go against every instinct you have as a caregiver. The medic who can make those difficult decisions while still maintaining compassion for every patient is the one who will save the most lives in the long run. Sarah participated actively in the ethical discussion, sharing her thought process and the factors she had considered when making her triage decision. Her willingness to engage with the difficult moral aspects of combat medicine impressed both instructors and classmates, many of whom had struggled with similar decisions during their own simulations. Several students approached Sarah after the debriefing to ask about her decision-making process and to share their own experiences with the ethical challenges of the exercise. For the first time since beginning the program, Sarah felt like she was being treated as a peer and colleague by her classmates rather than an outsider who didn't belong. The second advanced simulation took place 3 days later and focused on evacuation medicine, providing care for critically injured patients during helicopter and vehicle transport. Students were required to maintain patient stability while dealing with the unique challenges of providing medical care in moving vehicles, including space limitations, equipment constraints, and environmental factors like noise and vibration. Sarah was assigned to work as the primary medic for a simulated helicopter evacuation of a patient with severe traumatic brain injury. The scenario required her to monitor the patient's neurological status continuously, manage intracranial pressure, and coordinate with the flight crew regarding any changes in the patient's condition that might affect transport decisions. The simulation helicopter was equipped with realistic medical equipment, and was designed to replicate the cramped, noisy conditions of an actual medical evacuation flight. Sarah had to work while wearing full flight gear, including helmet and safety equipment that limited her mobility and visibility. The patient for this simulation was a sophisticated medical mannequin capable of realistic physiological responses to treatment interventions. Changes in the patient's condition were controlled by instructors who could simulate various medical emergencies that might occur during transport, requiring the student medic to recognize problems quickly and respond appropriately. As the simulated flight began, Sarah established baseline vital signs and neurological assessments for her patient. The mannequin was programmed to show signs of increased intracranial pressure, including changes in pupil response, altered breathing patterns, and fluctuations in blood pressure that indicated worsening brain injury. Working in the confined space of the helicopter, Sarah had to carefully monitor multiple physiological parameters while also preparing for potential interventions that might be needed during the flight. She established additional access, prepared medications for managing intracranial pressure, and coordinated with the simulated flight crew regarding the patient's status. Halfway through the simulation, the patient's condition began to deteriorate rapidly. The mannequin showed signs of herniation, a life-threatening condition where increased pressure in the skull causes brain tissue to shift and compress vital structures. This was a medical emergency that required immediate intervention to prevent irreversible brain damage or death. Sarah recognized the signs of herniation immediately and began implementing emergency protocols. She administered medications to reduce intracranial pressure, hyperventilated the patient to optimize brain oxygenation, and prepared for the possibility of emergency surgical intervention if the patient's condition continued to worsen. The treatment decisions Sarah made during this critical phase of the simulation would determine whether the patient survived the evacuation flight. She had to balance the need for aggressive intervention with the limitations of providing care in a moving aircraft, while also considering the risks and benefits of each treatment option. Sarah's quick recognition of the patient's deteriorating condition and her appropriate emergency intervention stabilized the mannequin's vital signs and prevented further neurological deterioration. By the end of the simulated flight, the patient's condition had improved enough that he could be safely transferred to a neurosurgical facility for definitive care. The evacuation medicine simulation was followed by an immediate hot wash where instructors reviewed Sarah's performance in real time. They praised her ability to recognize subtle changes in the patient's neurological status, her appropriate use of emergency interventions, and her effective communication with the flight crew throughout the scenario. Martinez demonstrated exactly the kind of clinical judgment and technical skill we expect from our graduates, one of the instructor physicians commented during the debrief. Her ability to function effectively in the challenging environment of helicopter evacuation while providing sophisticated medical care shows that she's ready for independent practice as a combat medic. The positive feedback from the evacuation simulation gave Sarah confidence as she approached the final phase of the advanced combat medicine training. She had successfully demonstrated her abilities in multiple realistic scenarios and had earned recognition from instructors for her clinical skills and professional judgment. However, Sarah knew that the most challenging test was still ahead. The program's capstone exercise would be a comprehensive scenario lasting several hours that would test everything students had learned throughout their training. This final exercise would determine whether each student was ready to graduate and deploy as a qualified combat medic. The capstone exercise was scheduled for the following week, giving students time to prepare mentally and physically for the most demanding test of their training. Sarah used this preparation time to review key concepts, practice critical procedures, and ensure that her equipment and supplies were properly organized and maintained. She also spent time reflecting on how much she had grown and changed since arriving at Fort Sam Houston months earlier. The shy, insecure young woman who had been intimidated by her classmates' impressive backgrounds seemed like a different person entirely. Through hard work, determination, and a willingness to learn from both successes and failures, Sarah had developed into a confident, competent medical professional. The night before the capstone exercise, Sarah's study group gathered one final time to review key concepts and provide mutual support and encouragement. Kevin, Lisa, and several other students who had become close friends during the program spent the evening sharing their hopes and concerns about the upcoming test and their future deployments as combat medics. "Whatever happens tomorrow," Lisa said as the group prepared to return to their barracks, "I want you all to know that I'm proud to have trained alongside you. You're going to be great medics, and I know that soldiers will be lucky to have you taking care of them when they need it most." Sarah felt a surge of gratitude for the friendships she had formed during the program and for the support her classmates had provided throughout the most challenging months of her life. Regardless of what happened in the capstone exercise, she knew that she had accomplished something significant by completing the advanced combat medical training program and earning the respect of her peers and instructors. The capstone exercise began at dawn on a humid Texas morning that would test every aspect of the students' training in combat medicine. The scenario was designed to simulate a complex multi-day operation where students would face cascading medical emergencies, equipment failures, resource shortages, and the kind of impossible decisions that define combat medicine in active war zones. Sarah arrived at the training facility before sunrise, carrying her fully loaded medical kit and wearing the complete combat gear that would be required throughout the exercise. The weight of her equipment felt familiar now, a reminder of how much her physical and mental endurance had improved during the months of intensive training. The exercise scenario involved a forward operating base that had been cut off from resupply and reinforcement due to enemy activity in the surrounding area. Students would serve as the primary medical staff for the base, responsible for treating casualties from ongoing operations while also maintaining the health and readiness of the base personnel. What made this capstone exercise particularly challenging was that students didn't know what specific scenarios they would face or when medical emergencies would occur. Instructors had designed the exercise to replicate the unpredictable nature of combat operations, where medics might go from routine sick call to life-or-death trauma surgery within a matter of minutes. Sarah was assigned to work with a team of 4 other students in managing the base medical facility. Her teammates included Kevin, whose quiet competence had made him one of her closest friends during training, and Amanda, who had performed exceptionally well during their previous simulation exercises. The other 2 team members were students she knew less well but who had demonstrated strong clinical skills throughout the program. The team's first challenge came within an hour of the exercise beginning. A simulated patrol returned to the base with 3 casualties from an improvised explosive device attack. The injuries ranged from relatively minor cuts and bruises to severe trauma that would require immediate surgical intervention. What complicated this initial scenario was that the base's primary medical equipment had been damaged during a mortar attack earlier that morning. Students had to provide advanced trauma care using only backup equipment and improvised solutions, testing their ability to adapt standard procedures to non-standard conditions. Sarah found herself treating the most critically injured casualty, a simulated soldier with severe abdominal trauma and signs of internal bleeding. The patient required immediate surgery to prevent death from hemorrhage, but the base's surgical equipment was among the systems that had been damaged in the simulated attack. Working with Kevin and Amanda, Sarah began implementing emergency surgical procedures using the limited equipment available to them. She had studied these contingency procedures extensively but had never performed them under the pressure of an actual emergency scenario. The improvised surgery required Sarah to demonstrate not just technical surgical skills but also leadership and decision-making abilities under extreme pressure. She had to coordinate her team's efforts, make critical decisions about surgical approach and priorities, and manage complications that arose during the procedure. As Sarah worked to control the patient's internal bleeding, she encountered a complication that wasn't covered in any of her textbook studies. The patient's anatomy was slightly unusual, making it difficult to identify the source of bleeding using standard surgical approaches. Sarah had to think creatively and adapt her surgical technique to address the unique challenges presented by this particular case. Drawing on principles she had learned about vascular anatomy and surgical problem-solving, Sarah developed an alternative approach that allowed her to identify and repair the bleeding vessel. Her willingness to think beyond standard procedures and adapt to unexpected challenges proved crucial in stabilizing the patient's condition. The surgical intervention was successful, and the patient's vital signs improved dramatically once the bleeding was controlled. Sarah's team had demonstrated exactly the kind of adaptive problem-solving and clinical excellence that the capstone exercise was designed to test. However, the successful surgery was only the beginning of the challenges Sarah's team would face during the capstone exercise. Over the next several hours, they were confronted with a series of medical emergencies that tested different aspects of their training and pushed them to their physical and mental limits. A simulated chemical weapons attack resulted in multiple casualties with respiratory distress and neurological symptoms that required specialized treatment protocols. Sarah's team had to establish decontamination procedures, manage patients with chemical exposure, and coordinate with other medical teams to ensure that the treatment facility didn't become contaminated. The chemical exposure scenario was particularly challenging because it required students to work while wearing protective equipment that limited their dexterity and visibility. Sarah had to perform complex medical procedures while wearing a full chemical protection suit, communicating with her team through radio headsets, and managing patients who were frightened and disoriented by their symptoms. Sarah's background in practical problem-solving served her well during this phase of the exercise. While some students struggled with the bulky protective equipment and communication challenges, Sarah adapted quickly to the constraints and found ways to work efficiently despite the limitations. Her team successfully treated all casualties from the chemical attack, implementing proper decontamination procedures and providing appropriate medical care for chemical exposure symptoms. Their performance during this scenario demonstrated their readiness to handle one of the most complex and dangerous situations combat medics might face in deployment. The afternoon portion of the capstone exercise introduced resource management challenges that tested students' ability to make difficult decisions about allocating limited medical supplies and personnel. Sarah's team was informed that resupply operations had been delayed indefinitely, and they would need to manage their medical resources carefully to ensure they could continue providing care for an unknown duration. This resource management scenario forced students to prioritize different types of medical care and make difficult decisions about rationing supplies. Sarah found herself in the position of having to choose between providing optimal care for current patients and conserving resources for future emergencies that might occur. The ethical challenges of resource management in combat medicine were among the most difficult aspects of the capstone exercise. Sarah had to balance her commitment to providing the best possible care for every patient with the practical realities of operating in a resource-constrained environment where difficult decisions were sometimes necessary. Sarah's approach to these ethical challenges reflected the maturity and professional judgment she had developed throughout her training. She consulted with her teammates and followed established triage and resource allocation protocols while also looking for creative ways to maximize their ability to help patients within their operational constraints. As the capstone exercise entered its final phase, Sarah's team was confronted with the most challenging scenario of the entire training program. A mass casualty event resulted in more than 20 injured patients arriving at their medical facility simultaneously, with injuries ranging from minor to life-threatening. The sheer number of casualties overwhelmed the base's normal treatment capacity, requiring Sarah's team to implement large-scale triage procedures and manage multiple critical patients simultaneously. This scenario tested every aspect of their training, from basic medical skills to leadership abilities and stress management under extreme pressure. Sarah took on a leadership role during the mass casualty event, coordinating triage efforts and ensuring that critical patients received appropriate priority for treatment and evacuation. Her systematic approach to triage and her ability to maintain clear thinking under pressure proved invaluable in managing the complex scenario. Working with her team, Sarah successfully implemented a triage system that maximized their ability to save lives while ensuring that limited resources were allocated appropriately. Her leadership during this critical phase of the exercise demonstrated the kind of professional competence and judgment that would be essential in actual combat deployments. The mass casualty scenario also provided Sarah with an opportunity to demonstrate the technical skills and creative problem-solving abilities she had developed throughout her training. When standard treatment protocols proved insufficient for some of the more complex injuries, Sarah adapted her approach and found innovative solutions that allowed her to provide effective care despite challenging circumstances. One patient in particular presented a combination of injuries that required Sarah to think beyond standard treatment algorithms. The patient had both severe burns and traumatic injuries that needed to be managed simultaneously, with treatment decisions for one type of injury affecting the approach to treating the other. Sarah's solution involved a carefully coordinated treatment plan that addressed both types of injuries while minimizing the complications that could arise from treating such complex trauma. Her approach demonstrated not just technical competence but also the kind of sophisticated clinical reasoning that distinguished exceptional medics from merely competent ones. As the capstone exercise drew to a close, Sarah reflected on how much she had grown during her time in the combat medical training program. The young woman who had been intimidated by her classmates' impressive backgrounds and had doubted her own abilities seemed like a completely different person. Through months of intensive study, challenging practical exercises, and gradual confidence building, Sarah had developed into a skilled medical professional who could function effectively under the most demanding circumstances. More importantly, she had learned to trust her own judgment and abilities while also maintaining the humility and willingness to learn that would serve her well throughout her career. The final phase of the capstone exercise included a comprehensive debriefing where instructors reviewed each student's performance throughout the day-long scenario. Sarah's performance was evaluated not just on her technical medical skills but also on her leadership abilities, ethical decision-making, and adaptability under pressure. When Sarah's individual performance review began, she was surprised to find that all of her instructors were present, including several senior medical officers she had only seen occasionally during the program. The formal tone of the meeting made her nervous, and she wondered if there had been some problem with her performance during the exercise. Sergeant First Class Rodriguez began the debriefing by reviewing Sarah's overall performance throughout the combat medical training program. He highlighted her academic achievements, her improvement in practical skills, and her demonstration of professional judgment during various exercises and simulations. "Martinez," Rodriguez said, looking directly at her, "your performance during this program has been exceptional in several ways. You've demonstrated not just technical competence but also the kind of adaptive thinking and creative problem-solving that we look for in our most capable medics." Rodriguez paused and exchanged glances with the other instructors before continuing. "What many students don't realize is that some of the scenarios in our training program are not just educational exercises. Some are based on actual classified medical techniques and procedures that have been developed specifically for military applications." Sarah felt a surge of confusion. She wasn't sure why Rodriguez was telling her this or what it had to do with her performance evaluation. Rodriguez continued, "Do you remember the improvised tourniquet you created during your first practical exercise? The one that your classmates mocked as hillbilly first aid?" Sarah's face flushed with embarrassment as she remembered that humiliating experience from early in her training. She had tried not to think about it since then, focusing instead on proving herself through conventional applications of her medical knowledge. "That technique you used," Rodriguez said quietly, "is actually a classified emergency procedure that we teach only to special operations medics who are deployed in situations where they might not have access to standard medical equipment." Sarah stared at Rodriguez in shock, not sure she had heard correctly. The improvised tourniquet technique that had made her the subject of ridicule throughout her training company was actually a legitimate military medical procedure. "The windlass tourniquet technique you demonstrated is part of a classified training program for combat medics who operate in austere environments where improvisation and adaptation are essential for mission success," Rodriguez explained. "Your instinctive understanding of the basic principles behind that technique indicated to us that you had the kind of thinking we look for in our most advanced medical specialists." Another instructor, a colonel whom Sarah had only seen once before during the program, spoke up for the first time. "Martinez, we've been watching your performance throughout this program very carefully. Your ability to think creatively, adapt to challenging circumstances, and maintain professional competence under pressure has impressed all of us." The colonel continued, "We'd like to offer you the opportunity to volunteer for additional training that would prepare you for deployment with special operations units. This advanced training would qualify you for assignments that require the highest levels of medical expertise and operational flexibility." Sarah felt overwhelmed by the unexpected offer. She had come into the program hoping simply to complete her training successfully and serve competently as a combat medic. The possibility of being selected for special operations assignments was beyond anything she had imagined. "I understand this is a significant decision," the colonel said, "and you don't need to give us an answer immediately. But I want you to understand that your selection for this opportunity is based on demonstrated exceptional performance throughout your training, not just during the final exercise." Rodriguez added, "The improvised tourniquet technique that you thought was a sign of your inadequate preparation was actually evidence that you understand combat medicine at a level that most medics never achieve. Your willingness to think beyond standard procedures and find innovative solutions is exactly what we need for our most challenging missions." Sarah realized that the experience that had caused her the most embarrassment and self-doubt during her training had actually been evidence of abilities she didn't know she possessed. The ridicule she had faced from her classmates had been based on their own limited understanding of advanced combat medicine applications. "Sergeant Rodriguez," Sarah said carefully, "are you telling me that the technique I used was actually correct, even though it didn't follow the standard protocol we were taught in class?" "More than correct," Rodriguez replied. "It was innovative, effective, and demonstrated the kind of clinical reasoning we look for in our most capable medics. The fact that you developed that solution instinctively, without specific training in advanced improvisation techniques, indicated that you have natural abilities that can't be taught in a classroom. The colonel stood up and extended his hand to Sarah. Martinez, regardless of whether you decide to pursue the Special Operations medical training, you should know that you've completed this program with distinction. You've proven yourself to be an exceptional combat medic who will serve with honor wherever you're assigned. As Sarah shook the colonel's hand, she felt a profound sense of accomplishment and vindication. The journey from self-doubt and embarrassment to recognition and respect had been longer and more difficult than she ever could have imagined, but it had also been more rewarding than anything she had experienced in her life. The formal debriefing concluded with Sarah receiving her graduation certificate and assignment orders for her first duty station. She had not only completed one of the military's most demanding medical training programs but had done so with recognition for exceptional performance and potential for advanced assignments. As she left the debriefing room, Sarah reflected on how completely her perspective had changed since arriving at Fort Sam Houston. The technique that had made her feel like an imposter and an outsider had actually been evidence of her potential for excellence in combat medicine. Her classmates, who had mocked her improvised tourniquet as evidence of her inadequate preparation, had actually been witnessing a demonstration of advanced medical capabilities that they themselves didn't understand. The experience taught Sarah that confidence and competence are not always the same thing, and that true expertise sometimes involves thinking beyond what others consider acceptable or standard. The graduation ceremony took place the following week, with family members and friends invited to celebrate the achievements of the new combat medics. Sarah's mother and younger brother made the trip from Texas to attend the ceremony, their first opportunity to see the military environment where Sarah had been training. During the ceremony, Sarah was recognized not just as a graduate but as the distinguished honor graduate of her training class. The recognition was based on her overall performance throughout the program, including academic achievement, practical skills demonstration, and leadership potential. As she stood on the stage receiving recognition for her achievements, Sarah thought about the long journey that had brought her to this moment. From the small-town diner where she had worked to support her family, through the months of intensive medical training, to this moment of recognition and accomplishment, she had proven to herself and others that dedication and determination could overcome any initial disadvantages. The young woman who had once felt intimidated by her classmates' impressive backgrounds had discovered that her own unique experiences and perspective were actually valuable assets in combat medicine. Her practical problem-solving skills, developed through years of helping her family overcome various challenges, had proven to be exactly what was needed for success in the most demanding medical situations. Sarah's story had become an inspiration not just for her own future but also for other students who might face similar challenges in overcoming self-doubt and proving their capabilities. Her experience demonstrated that true competence in combat medicine came not just from textbook knowledge but from the ability to think creatively, adapt to challenging circumstances, and maintain focus on the fundamental goal of saving lives. As she looked toward her future assignments as a combat medic, Sarah felt confident that she was prepared for whatever challenges awaited her. The training program had tested her abilities in every conceivable way, and she had proven to herself that she could meet any professional challenge with competence and dignity. The improvised tourniquet that had once been a source of embarrassment had become a symbol of her potential for excellence in combat medicine. The technique that others had mocked as inadequate had actually been evidence of the kind of innovative thinking that distinguished exceptional medics from merely competent ones. Sarah Martinez had begun her military medical career as a young woman seeking financial stability and educational opportunities for her family. She was ending her training as a recognized expert in combat medicine with opportunities for advanced assignments, and the confidence that comes from knowing she could handle whatever challenges her military service might bring.